The following presentation will outline the process for pre-screening of a new client. It will look at their aspirations of current goals, needs analysis relating to their desired outcomes, as well as a potential action plan to achieve said goals. When working as an exercise professional, it is important to always pre-screen clients. Pre-screening is a necessary component to a client's consultation as it assists health professionals in the current health status of an individual. It can identify previous or current health issues that enable an opportunity to effectively and safely prescribe exercise. The pre-screening tool used most commonly by fitness professionals is the PAR-Q pre-screening due to its simple, safe, and effective basis of exercise clearance. However, PAR-Q, like many other screening tools, often offer limitations imposed by various chronic health conditions. Hence why further screening tools were used in conjunction. These include the SS pre-screening tool, lifestyle checklist, and consultation notes, allowing for an in-depth look into a client's current health status. ESSA pre-screening tool showed the following results. His height was 170.1 centimeters, his weight was 70.3 kilograms, BMI was 24.3, which put him in a normal category according to the ACSM guidelines. He was a non-smoker, he was active for more than 150 minutes per week, has normal blood pressure, has normal blood sugar levels, no hospital visits within the last 12 months, taking no medications, and no muscle or joint pain. The client answered no to all 7 of the PAR-Q questions, giving him 0 risk factors, allowing him to undertake exercise of high to vigorous intensity. Results from all tools indicated he was a fit and healthy individual with no prior health conditions restricting his capability of exercise, therefore placing him in a low-risk category. Initial client notes have indicated that the client trains 4 times a week for 60 minutes as he's currently in off-season. His daily life has been noted to be very time restrictive due to university 4 days a week and interning also 4 days a week. He currently does not work and lives at home. The client, Jimmy, is a 21-year-old male rugby league player who predominantly plays the wing position, with a dream of wanting to play professionally. After just missing out on first grade selection of the Q Cup, Jimmy has come to seek professional advice to develop himself into a better player and overall improve his athletic performance. Jimmy has identified many goals in his initial screening and have been broken down into health, behaviour, and exercise performance. For health goals, Jimmy has identified he wants to add more muscle to his frame and reduce body fat, increase strength, and improve his cardiovascular endurance. For behaviour, Jimmy has identified he lacks knowledge of good food nutrition and also wants to improve his time management skills. For exercise performance, Jimmy would like to increase power, increase speed, and increase agility. Rugby league is a team contact sport played in several countries worldwide. A rugby league team consists of 13 players, 6 forwards, 7 backs. The game is played over 2 40-minute halves separated by 10-minute rest interval. During a match, players often perform bouts of high-intensity activity separated by short bouts of lower intensity. At the elite level, rugby league players have well-developed aerobic and anaerobic endurance, muscular strength, power, agility, and speed. Players' upper and lower body strength and aerobic power have been associated with a broad range of technical and sport-specific skills, and in addition is associated with a lower risk of injury. Elite players usually have well-developed physiques, including reduced skin fold thickness. Gabbett has determined player-repeated sprint ability and prolonged high-intensity intermittent running ability, along with lower body muscular power and faster speeds, are linked to effective playing performance in National Rugby League players. Furthermore, the ability to generate high muscular power is an important attribute of rugby league players. Players are required to have high muscular power to perform the tackling, lifting, pushing, and pulling tasks that often occur during a match. Finally, Gabbett has explained an understanding of the movement patterns and physiological demands of different positions would allow the development of strength and conditioning programs to meet the precise requirements of player positions. With this in mind, wingers are traditionally the fastest players on the team and used in attacking play to receive and run the ball in an attempt to make as much ground as possible. The position is categorized by high intensity strength and power type activities, followed by brief periods of rest. A study of 112 athletes playing within the English Super Rugby League found on average wingers have a total of 13% body fat and a total mass of 91 kilograms. Results from individual playing positions found wingers to have a significantly less 15-metre sprint time than props, and when comparing 40-metre sprint times, wingers were significantly less than locks, halfbacks, and 5/8s, suggesting that the need for speed and explosive power is a necessity. This enhanced acceleration from wingers have been shown to be a contributing factor of effective tackling ability in junior rugby league players. Recommendations for health goals. To increase muscular strength, we'll initiate a strength program and test his 1 RM bench, squat, and deadlift before and after strength program. For lean muscle, will be determined by measuring skin folds, and determination of cardiovascular fitness will be from repeated sprint tests, i.e., beep tests. To achieve behavior goals, Jimmy will see a dietitian and start a food diary, as well as keeping a daily schedule to ensure his time management is adhered to. Exercise performance goals will be incorporated into the exercise programs with testing of speed over the 15 and 40-meter distances, as well as agility by the Illinois Agility Test over the course of the client's next phase of training. In conclusion, by incorporating the above recommendations that are in line with the attributes of the sport, the client will ensure his athletic performance has the best possible chance of improvement. Thank you for listening.